So this is the opportunity for me to introduce myself. I'm Steve Larson, member of the editorial staff up here at Hoard's Dairyman magazine. I'm broadcasting here this afternoon from Fort Atkinson, Wisconsin. And we are glad to have many of you with us today. It's always good to have you on board. Mike Hutchins is traveling today, and so I will not be relying on him as a co-host. We wish him well in his travels. So my job now is to say that this reproductive update today, which we'll be hearing, is brought to us sponsorship by Parnell. And our presenter today, we're very happy to have him, is Dr. Jeff Stevenson from Kansas State University. Jeff, he was trained and received his PhD at North Carolina State. He's a full professor down there at K-State in the Department of Animal Science and Industry. And in addition to his teaching and research appointment since 1991, he is a monthly contributor to the Hoard's Dairyman's artificial breeding column, and we've always appreciated greatly his contribution to the magazine through that column. He's authored more than 170 scientific journal papers, and since 1990, Dr. Stevenson's research has been recognized by groups such as the American Dairy Science Association, National Association of Animal Breeders, and American Society of Animal Science. So, Jeff, a good longtime friend of Hoard's Dairyman, we're glad to have you as our presenter, and we invite you to take off and start your presentation.
Okay, thank you very much, Steve. It's a privilege to be with you folks today, and hopefully some of the things we'll talk about will be of benefit to you in your operations or in your business. This is the outline I'm going to follow. Talk a little bit about one slide, the next slide, the progress that's occurred in reproductive management in dairy cows. And we'll spend some time talking about heat detection and these new activity monitors and where I think they have a place in the industry. I'll review a couple of principles about timed artificial insemination programs and a little bit on pregnancy diagnosis and pregnancy detection. So let's get started by this slide, which if you're a Hoard's Dairyman reader, you will see this slide in the February 10th issue of Hoard's. It's something that I borrowed from a colleague of mine, and we kind of revamped it so we could look at all the technology that's come about since 1979, 1980. My career started here at the university in 1980, but you can see that there's several of the hormones we all use regularly in our AI programs, prostaglandins, GnRH products, came about in that early part of that 1980. And the time breeding programs that came about in the mid-90s and were developed, and we continue to tweak those programs to make them better. Some of the technology, the first pedometer came out in 1983 and later refined in about 2005 when the accelerometers came about, and we'll talk about those in just a few minutes. We've also had the advent of the CEDAR, the progesterone intravaginal insert, that's been available since 2003, and that's a real benefit to our breeding programs, particularly in heifers and in anovulatory cows. And then the advent of genomics and sex semen has really brought about some great advances and opportunities for better managing dairy cows. So we're going to talk about heat detection and activity monitors. So let's go to our first poll and have you answer this, tick what you think is your method for heat detection.
Okay, the voting has started. I would have to say, representing now the Hoard's Dairyman farm, that we use kind of a combination. We use pedometers and activity monitoring, and we do use observation, visual observation. So those are the two that I would pick for the Hoard's Dairyman farm. And so how's the voting going, Jim?
It's going pretty good, and you can remember that you can pick more than one if you have more than one.
So I'm looking for the poll results.
Looks like it's stabilized. It's stabilized now. We've got
okay. So let's see what the results.
74% people ticked visual observation. 48% ticked heat mount patches, which would also include tail paint or tail chalk. Nobody's using the heat watch printer sensitive devices that are available. 43% using pedometers or activity monitors. 4% using very little heat detection and nearly all timed AI. Interesting results, a little different than perhaps I would expect, but so it looks like we've got some users out there of some of the technology. So let's talk a little bit more about heat detection methods. This is data from the NOM survey that was done in 2007 by APHIS, and you'll see. First of all, let me just mention that these data were collected before activity monitors really came to the market full bore. So you can see that 93% of the people in that survey were using visual detection, visual observation rather. Tail paint, chalk, and bowls were interesting heat detection methods that are being used. Heat mount patches, not too many at that point in time. The heat watch was very small at 6%, and then you can see pedometers and others were very, very small. You notice over here the heat patches, these heat mount patches. We've used these a lot. I really have a lot of confidence in them. I call them lottery tickets because they rub off like a lottery ticket. And nice thing about them, they really, really do stay stuck on cows. And I've found them pretty useful in some of the studies we've done. And I think they're an added advantage to the market for people who are watching cows and able to walk behind cows every day, as opposed to using, say, tail paint and tail chalk. Probably a little more expensive than the tail paint and tail chalk. Here's a tip that I've got from Dairyman I work with. You see they tail chalk or paint chalk these cows. I put a 9 on that cow since today is 9. If that cow was in heat today and that tail chalk was rubbed off, a lot of guys like to put that day right there on the slide, right there on the cow, so that when they come back and check those cows the next day or so, they know when she was last inseminated. And it saves a little bit of time sometimes when you're not sure when that cow was last bred. Your hands are cold and you don't want to get out your PDA or smartphone to look up the records. And it's just a real handy thing that they use those numbers, the date of the insemination. And there's a lot of people that use different colored chalk. So we work with dairies that when the preg check occurs, they like to use a green chalk, add a green chalk or green paint to the tail head of the cow so they know that cow's been detected pregnant. They use a red or an orange for cows that are unknown, their status is unknown. And when they find a cow open on preg check day, they'll use a blue chalk. And then that blue chalk, when they address that open cow with some type of program or resync program, they'll eventually change that to a yellow chalk. So there's lots of different ways of doing it, and some of you probably are mastered that, but I think that's a good tip, and we found that quite useful when we work with our cows here at Kansas State University. Okay, let's talk a little bit about what happens when a cow comes into heat. You notice down there in the bottom corner, the cow is standing in estrus. When she does, she has a nice dominant follicle, as you can see on the slide right there, and that dominant follicle is going to produce estrogen. When estrogen peaks in the blood supply about this point in time, that's when that cow will stand in estrus for the very first time. Typically, our lactating dairy cows are going to stand in estrus for anywhere from 4 to maybe 12 hours. But what's pretty consistent about our cows is they will ovulate about 28 hours after that first standing event. The peak in estrogen that you see there that's produced by the follicle is what causes the surge of what we call luteinizing hormone that induces the ovulation. And so this is the hormone that causes ovulation. And what's really important about this whole process is we're really more interested in detecting ovulation than heat detection, although we can't do that very easily except with ultrasound. The whole idea is we're trying to detect that cow properly so that we can inseminate her at the proper time. What's really important about the onset of estrus here and the physical activity that occurs in dairy cows, when they come into heat, their physical activity increases about 400%. And so that's why these activity monitors, as you see in this slide, have come to the market. There's at least 13 of them in the U.S. Canadian market right now, and you can see a whole list of them there. They include monitoring activity, all of them. Some of them monitor actually eating bouts, or what we'd call rumination, which is very helpful in monitoring individual cows. And then most of them either interact with the web or the cloud and to where the data goes. Two of the newest ones out on the market are this Aegis, which is a product from the Netherlands, and the SmartBro product, which are an ear tag, which has the activity monitor in the ear tag, and also measures rumination and also ear temperature, which is, of course, ear temperature is going to be a little bit less than body temperature, but it does give you a relative change in temperature of the cow when she may be showing fever, and particularly in your fresher transition cows. So these activity monitors work fairly simply. They have a sensor. That sensor then detects the activity movement. There's very specialized algorithms or software programs that are part of that teases apart the activity that's associated with estrus, and then it uploads that information either in the parlor by Wi-Fi or in the holding pen, and then that data is then displayed in some type of software visualization that you can see here. Shown in the next slide is actually the insides of a couple of these different activity monitors. These two products, the Heat Time or SCR product and the Dairymaster product, are two that have accelerometers. Many of the new ones also do. The accelerometer is a really unique device. It's able to detect movement in all three spatial planes. And so if you think about a pilot that's flying an airline, and he's an airplane or jet, and he's wanting to keep that jet level, side to side as well as front to back, that accelerometer tells him where he is relative to space. And so these accelerometers have really increased the accuracy of the data that we're getting from activity monitors that are available on the market. This is an example of the Dairymaster activity monitor that we use at the Kansas State University Dairy, and it has the bars down here at the bottom represent a 24-hour period. There's a threshold, as you can see the dotted blue line right here. This happened to be a cow that we did not breed, but you can see that the activity as part of 2 20-hour periods went well above threshold. And on this cow we had a heat watch patch, so we knew how many times she stood, as well as the activity monitor. So you'll notice that she stood about 9 o'clock on the 7th of January. She last stood the next morning about 6 a.m., so she was in heat about 9 hours. She stood 15 times for a total of 25 seconds, and she ovulated based on our frequent scanning in this research project. She ovulated 29 hours after she first stood. The Select Detect system showed that she went above the threshold line at 10 p.m., which was pretty close to when she stood the first time. She ovulated at 1:55 a.m. on the 9th, and so she ovulated 28 hours after threshold. So it agreed pretty well with the actual standing behavior of the cow. And so we found that, at least with this monitor and most of them, when they reach a threshold, that's usually very close to the onset of heat. They will be above threshold much longer than they are standing in heat. So their activity increases, they're moving around, they may be mounting, but they really don't mount or start estrus until partway after they've gone through threshold, and then after the threshold, or after they go out of standing heat, they still are quite active, and so the activity is actually a little bit longer than the duration of estrus. So this next slide illustrates some data that comes out of the Dairymaster. The new Dairymaster, which we do not have, it has rumination, and that's what's shown here in the green line. So it's actually showing you minutes per day that the cow is ruminating, or she's chewing her cud, which is different than eating, obviously. The milk yield is shown in the diamonds and the black line here. This is actually a pasture cow. You can tell that the milk production is around 45 to 50 pounds, so it's not a confinement-fed cow. And then the actual activity bars that show winter activity is shown on a daily basis. Notice that when her rumination dropped off here on the 5th of October, and came back up and dropped off again, there was a health alert there. It indicates to the dairy managers there that perhaps they need to look at this cow. There may be some issue with her. So it gives you a lot of information that we wouldn't have on an individual cow basis, so one can manage individual cows using this type of data. And of course, the activity monitor is just one of the activity rather is just one of the blessings that you have with these type of monitors that allows you to monitor for estrus. I want to illustrate a couple of studies that have been done that show how effective using an activity monitor system compared to a timed AI program. And this study we're looking at here, the cows, this is all in one Pennsylvania herd. These cows had activity monitors attached to them, and the other half of the herd was used in a timed AI program. And the cows in the timed AI program stayed on that program and throughout their lactation, whereas those that had activity monitors, they used them for the first 3 services and then they discontinued the study. So you'll notice that the conception at first AI was a little bit less than the activity monitors. That's not always the case. The overall conception was slightly lower, but here's the big advantage that you see with using the activity monitors. The activity monitors actually increase the estrus detection rate in these cows almost 2-fold. And that's really important. That's one of the things that we see with the activity monitors. It helps us detect that very first estrus that occurs after she's been bred. And so what we see is actually a shortening or a reduction in the inter-insemination intervals, which means we're getting the semen in those cows at a faster rate so we can get them pregnant sooner. You'll notice here that the days in milk when 50% of the cows were pregnant was a little bit more in the timed AI group, but the percent pregnant at 150 days in milk was greater in the activity monitor group. And so these activity monitors can really add some value to the herd. And you can see in this within herd comparison, there were some pluses and minuses, but in reality, more cows got pregnant by 150 days in milk, and that's really what we're looking for, is getting cows pregnant in a very prompt manner in the dairy herd. Here's another study that involved actually 3 herds, same kind of study. Cows were compared within herd, so these cows were time AI'd. At first service, these cows were using activity monitors. And you'd expect, starting from the voluntary waiting period, if we use a timed insemination, we're going to inseminate all those cows, and so the days to first AI after the voluntary waiting period was significantly shorter than using the activity monitor. Conception rates at that first AI were very similar. Repeat conception rates were very similar. Percent of cows pregnant at 90 days in milk was very similar. So all this is showing is that activity monitors can be used and equal the results that you can get with a timed AI program. This last slide, we're talking about activity monitors, is one that is actually a combination of data from one of our studies and one from the University of Wisconsin. So what we're looking at here are cows that were on activity monitors. There were 2 different monitors used. In one herd, they used the SCR monitor. In our herd, we used the Dairymaster monitor. This group of cows used the heat mount detectors, as you can see here. This would be a detector off a cow that's been mounted several times, and so it's completely red. And then we had cows that used the heat watch devices, the pressure sensitive device that's triggered when a cow mounts the cow that has this device attached to her tail head. So let me tell you how the study was done. The purpose was to determine if we can detect all the estrus activity. So these cows were set up with a program so that we knew when they got prostaglandin, the first day of the breeding week, that they had a corpus luteum, and 3 days later we knew that corpus luteum regressed based on blood progesterone. So those cows should have been coming into estrus based on our progesterone concentrations, And also, at the time we gave prostaglandin, they had a good follicle that we'd expect that could go ahead and produce estrogen and eventually ovulate after the surge of LH that we talked about earlier. So you can see here in that first bar, first horizontal row here, the activity monitors picked up only 70% of the cows that should have been in estrus based on the scenario I described. The heat mount detectors were equally effective. The heat watch was a little bit less. And that's part of that is due to the fact that those patches, if they move just a little bit on the tail head, sometimes when the cow jumps on that mounts that cow, those buttons don't always get depressed. Notice that the cows, this is the number of cows or the proportion of cows that actually ovulated that showed estrus. So if they showed estrus, at least 95% of those cows ovulated. But here's the most important part of this study. Here's the residual cows that did not show estrus, that should have showed estrus based on the scenario I described. The interesting thing about that, there's about 28 to 38% of the cows that did not show estrus, but look at the proportion of cows that actually ovulated. So these cows truly, what I would say, had silent heats. Their estruses were not detected, but yet anywhere from 54 to 76% of them actually ovulated in the absence of any detectable estrus. So when people ask me what's the value of an activity monitor and should they invest in that, there's a couple of conditions that I would suggest that they consider. Many herds that are in dry lot or pasture usually have heat detection rates that are going to exceed 70%. If that's the case, they probably are not going to get a lot of value from an activity monitor in terms of detecting estrus. That's not to say that the activity monitor will not provide a benefit of catching all estruses and reducing the inter-insemination interval, because that's one of their advantages. But there will be cows that just will not be detected in estrus with these activity monitors. For folks that have cows that are confined continually on concrete, where heat detection is significantly less because of slippery conditions or the fact that based on herd size, there's not a lot of visual observation going on, there may be some real value of having activity monitors because it will pick up estrus activity by the increase in physical activity that's associated as a correlated trait with the onset of estrus and mounting and standing activity that's displayed by cows that are in estrus. So that's all I'm going to talk about in terms of heat activity and activity monitors. So let's go to our next part of what I'd like to update you on, and let's talk a little bit about timed AI programs for cows at First Services. And I just want to review what many of you may be very familiar with, and that's the standard programs that most people are using that we refer to as ovulation synchronization programs, or for short, we call them OVSync. There are two options. The most common option is the 7-day option here that I've highlighted in the top of the slide, where the green circles represent the injections of gonadotropin-releasing hormone. Prostaglandin is given here 7 days after what I'll call G1. Ideally, the best way to do it is about 56 hours after prostaglandin to give G2 or the second GnRH injection, and then inseminate at about 16 hours after that second GnRH injection. A 5-day option is an available option. It's a shorter option, so if you used a 7-day option, so this were Monday, Wednesday afternoon, Thursday morning, the 5-day option might be a Thursday morning, Tuesday morning, Wednesday morning, and then you'd breed on Friday, 72 hours after this prostaglandin injection. The 5-day option absolutely requires that you give 2 doses of prostaglandin 24 hours apart. The reason for that is if a follicle is ovulated in response to GnRH right here, that new young corpus luteum will only be about 4 days old right here and is not likely to respond to that prostaglandin injection. And so this is a fail-safe injection to make sure that that corpus luteum does in fact regress, progesterone declines, so that when we breed that cow 72 hours after the first prostaglandin injection, she has low progesterone and has the potential of conceiving when inseminated. Note also with the 5-day program that the GnRH, that second GnRH injection, or G2, is given simultaneous with the AI. And that seems to be the best way to do the 5-day program. People might ask, well, what do you use a 5-day program for? Veterinarians find it somewhat useful, particularly if all their clients want to do preg checks on Mondays and Tuesdays. So if you do your preg checks on Mondays and Tuesdays, that means you could do your timed AI program on Thursdays and Fridays of the next week. Or another option I'll give you later. A 5-day program allows you to do a preg check on, say, a Thursday. This becomes Tuesday, Wednesday, and then Friday. So it gives you an option to have a preg check on a day that's other than Monday and Tuesday. And it's a shorter program, but it then allows you to still have the benefits of an off-sync program when using a 5-day option. Most people still use the 7-day option, but the 5-day option it has its merits, as I've described, and so the fertility from resulting from a 5-day option is equal to what you would have in a 7-day option. So let me just use this slide to maybe help in your understanding of how a timed AI program relates to what we would normally have in a natural spontaneous estrus when a cow shows estrus. So I'm showing you here an ovary with a follicle on it. That's the follicle that's going to ovulate, produces estrogen, causes the cow to come into heat. She'll stand, as you see in the little diagram there. The LH surge occurs, and that induces ovulation in about 24 to 32 hours. Typically, using visual observation or tail chalk removal or whatever we're using, we're going to AI that cow according to the AM/PM rule, and we'll do that approximately 12 to 14 hours after we see the cow into estrus. And then we're going to see that sperm transport's going to take a little bit of time. She's going to require about 6 hours for those sperm to be transported from the site, the site of deposition, which usually is in the body of the uterus, and it moves up through the oviducts, and then a reservoir sperm form at that uterotubal junction, the junction of the uterine horn and the oviduct, and their sperm will then be released up the oviduct to allow fertilization eventually. Those sperm are going to be viable. Sorry, back up here. Those sperm are going to be viable for about 24 to 30 hours in that reproductive tract of the cow, but the egg viability is very, very short. It's only about 8 to 12 hours. And so the idea is that fertilization occurs. We want to have viable sperm in the lower part of the oviduct when that egg ovulates from the follicle. So if we compare that with what happens in a timed AI program, I want you to think about this second GnRH injection, or G2, as being the same time as when a cow starts her heat period or estrus period. We use the G1 and prostaglandin to set up that cow so that she has a follicle. If she has a follicle here at G1 and it ovulates, she'll have a new corpus luteum. She may have a corpus luteum already on her ovary. It could be on this ovary or the left ovary. And now she has a new CL if she responds to that G1 injection. 7 days later, we're going to initiate death of the corpus luteum, or what we call luteal regression, by giving prostaglandin. And then 56 hours later, approximately, we're going to give G2, and that's what causes the LH surge and eventually causes ovulation. So if you'll think about a cow that's coming into estrus, G2 is analogous to what we're doing there in a timed AI program. So G1 and PG is setting up that ovary so it functions as we desire. G2 is going to cause ovulation, just like we have a spontaneous ovulation occurring here in the absence of any outside injections. And then we're going to inseminate that cow about 14 to 18 hours after G2, which is analogous to putting semen in that cow about 12 hours after we first detected her in estrus. So you can see how the OVSYNC program correlates very well with what we would see spontaneously in cows that come to estrus all by themselves without any intervention on our part. So let me just talk for just a few minutes about some of the pre-sync options that are available at First Service. The best options are available, in my opinion, are shown in this slide. The pre-sync option is one that's been around since the early 2000s, 14 days between prostaglandin. The best wait here is 10 or 11 days before you start the OVSYNC program. The new pre-sync programs that use GnRH have some real advantages. They include GnRH. Notice that the double OVSYNC has 2 GnRH injections. These two programs, pre-sync programs, have GnRH involved. And what that GnRH does, it allows you to synchronize follicular development before you start OVSYNC, and it actually puts that cow, usually, so she has a mid-range progesterone concentration when she starts OVSYNC. And that's ideal because that allows a very high ovulation response to G1 and high progesterone in this period of time that makes that cow about as fertile as you can get her using timed AI. The other advantage of the GnRH pre-sync programs, the bottom 3 diagrams there, are the fact that they include GnRH. And if we have cows that are anovulatory before they get to this point, in other words, they've never developed their first corpus luteum, never shown heat since they've calved, GnRH here in these programs can cause that cow to ovulate so that she actually has a CL when you start this program. And so we find, based on the literature, you can see here, this is a comparison that we made of some of the data from the literature. The red bars indicate cows that use the standard prostaglandin pre-sync program, either what I call pre-10 or pre-12, that's the 10 days or 12 days between the second prostaglandin pre-sync injection and when you start OVSYNC, and then we're comparing that to either double OVSYNC or a PG3, which is another alternative. You can see that the fertility is actually improved here when they use the GnRH pre-sync. That's what we're generally seeing. There's also information coming out in the literature that suggests that the GnRH pre-syncs are better consistently in large data sets, and the advantage they have is just improving fertility at First Service. What we're generally seeing is that the GnRH pre-syncs tend to be a little bit better performing for first lactation cows than older cows, but on average they seem to be improving the fertility at first AI. And so we really think that using the GnRH pre-sync programs are giving you some added value that you don't have with just using the standard pre-sync program. So a couple of other things, updates. Many of you probably have heard that some people are using a second prostaglandin injection with OVSYNC now in the 7-day option, as you can see right here. Here's a good study that was done at the University of Wisconsin, where they compared cows that received just the 1 PG injection or cows that received 2 PG injections. Notice that you still give G2 at 56 hours after the first PG injection. Pregnancy risk or pregnancy rates tended to be greater, but it's only about 3%. So you don't get a big bang for your buck with that second prostaglandin injection, but you will see here that you bring the amount of CL regression almost in all the cows goes up to about 97% compared with just the 1 injection at 83%. But that only translates into about 3% more cows pregnant. Notice when they repeated this in about 10 different herds, the big advantage, or the advantage I should say, was really in the second and third lactation cows, and that's where that 3% advantage was really occurring. So the conclusion I've come to is that luteal regression is clearly enhanced, going up to 97% by that second injection of prostaglandin, but the pregnancy improvement is really marginal. It's only about 3%. And so It just depends on what an individual herd wants to do. The cost of that second injection relative to getting 3 more cows pregnant. If you bred 100 cows or you had 100 cows pregnant, you get 3 more cows pregnant out of 100 cows you inseminated. That may pay for those extra injections, but that's something you need to kind of pencil out on your own. But the advantage there is relatively quite small. Another thing that's been looked at is the dose of GnRH. And they've looked at the dose at GnRH at G1 and G2. So what we're looking at here are several studies I've combined. These are where cows were preg checked at 39 days, 42 to 56 days, or day 56. And there's 2 numbers there. That indicates the dose at G1 and the dose at G2. Okay? So what you can see here is the pregnancy rate. We're looking at the pregnancy rate. Clearly, when they increase the dosage to 150 or to 200, they did see an increase in ovulation rate. But you can see that the increase in pregnancy rate resulting from a larger dose of GnRH was really very small, and it was not significant. It was not statistically significant. So we can improve ovulation by increasing the dose, but the pregnancy rate responses do not justify increasing that dose of GnRH rather. So let's go to our next poll question. Well, I got one more thing to talk about, and then we'll go to our next poll question. The other thing that people always ask about is the timing. Let me just back up. The timing of this injection right here, where it ought to be, and I'll show you here at 56 hours. And so here's several studies that were done in first service cows and resync cows, where they tried giving that second dose of GnRH at different times. So the co-sync 48 would be cows that were given prostaglandin 48. I'm sorry, they were given GnRH or G2 48 hours after prostaglandin, and time inseminate at the same time, or they did a co-sync 72. G2 and time DI was 72 hours after prostaglandin. In this case, it's a single prostaglandin dose. Or they did the 56-hour, OVSync 56-hour that we've been talking about. Notice that if you look at the results, and there's quite a few numbers of cows that I've summarized here for you and number of herds, when they did the OVSync 56, there was an improvement in fertility, about 6 to 7 points. In Resync, again, it's anywhere from 7 to 9 points improvement in fertility if they do the OVSync. Based on what I told you earlier, and we looked at the comparison of cows in a timed AI program, the 56-hour mimics best what cows usually do spontaneously on their own. It's not always convenient because that injection often requires an injection that's in the afternoon when cows may not be locked up. And the co-sync 48 and the co-sync 72 is a lot easier because you're inseminating at the same time you're giving G2, but you are going to give up some, fertility by that added convenience. So that's what the data say, and so you can make that decision on your own whether you think that advantage is to pick up anywhere from 7 to 9 percentage units of cow pregnancy based on going with that OVSync 56. Now let's go to our poll, and let's have you indicate what program you employ before first services in your lactating cows. And you may check more than one, but we'll give you the results here.
This one's only one.
Okay, just one. Okay.
Just pick one, all right? And while our listeners are making that decision, making their choice, I might invite them to consider asking any questions that they would like to have Jeff Stevenson answer later at the end of the webinar. So there's hopefully there'll be some time for that, and so we encourage you to consider any that you might have. And I'm not seeing actually the polling progress, so I'll rely on Jeff and Jim down there to say when we should break this off.
Well, we have about 50%, and if
Okay.
Dr. Hutchins was here, he would be browbeating everybody, trying to get them to
He
vote.
would be. He'd be talking about the political parties in Chicago and things like that. But we miss his pep talks.
All right. Well, I think I'm going to close them off here, and
Okay. Let's see
we can
what
share the
people came up
results.
with. Great.
Okay, so we have 53% of the people checked AI after heat detection using little or no timed AI in their herds. 9% of the respondents are using some kind of GnRH pre-sync, as we talked about. 18% are using a prostaglandin pre-sync program. 21% are using the off-sync 56. And nobody checked CoSync 48 or CoSync 72. So based on some of the things we've talked about, you have some considerations perhaps to make in your herds, whether you think it's worth employing some of the things that we talked about in terms of using GnRH pre-syncs or using more off-sync 56s based on your convenience and what you can do in your herd. Okay. So let's go now to our next subject. I'm just going to spend just a few minutes talking about the resync programs, and I want to introduce that by talking about basically two options that most people are using in a resync off-sync program. So if we look at the AI, these are cows that have been inseminated over here, and this is our pregnancy check day right here. And so option one would be for those people that say, okay, I'm not going to do anything until the cow is found clearly open at pregnancy diagnosis, and that's when I'm going to initiate my off-sync program in all the cows that are open on that Monday, for example, as I show in this illustration. Keep in mind that it's really important that back here about 21 to 25 days we have a real opportunity to put some extra eyeball pressure or whatever you use in terms of your heat detection program to see those repeat heats that are going to occur in those cows typically between 21 and 25 days. Keep in mind that our Holsteins today tend to be more like 22 and 23 day cycles compared to what we would say classically was 21 days years ago. So that's one thing to keep in mind. So option one basically is we're not going to begin our resync program until we determine that cow is open at pregnancy diagnosis. Option two then would be for those that are a little bit more aggressive in their resync program, and they're going to go ahead and start all cows on an off-sync program 7 days before the pregnancy diagnosis occurs by giving GnRH or the G1 injection. And so the idea is that we don't know whether these cows are pregnant, but we're going to start the off-sync program at this point by giving GnRH so that we can finish the off-sync program once the cow has definitely been diagnosed not pregnant or open. And so what we're doing with this option is we're spending a little bit more, we're using a little bit more GnRH resources here and giving that GnRH injection 7 days before pregnancy check day, but it allows us then to re-inseminate those open cows 3 days after they've been determined open. And so we're basically going to reduce that inter-insemination interval by 7 days by adding a little bit more investment to using GnRH up front 7 days before we've identified whether those cows are actually open or not. So here are some options that are being used in the industry for resync cows. And these are pre-synchronization options. The idea behind this is if we can set up that cow for better fertility by doing something ahead of pregnancy diagnosis and improve fertility, that's the idea behind it. So you can see there's a number of options here. So this is pregnancy diagnosis day right here, okay? And this case they're using a pre-sync GnRH injection 7 days before they know whether or not that cow is open or not, and then they do a full 10-day off-sync program right here. They use a 7-day option. That was compared to cows that were given GnRH when they were found open, and 7 days later, then they had a full 10-day off-sync program. The third option here, they gave prostaglandin to those open cows, and then 12 days later started them on the 10-day off-sync program. Or in this case, they used a double off-sync. So that's the first gene-RH injection of double off-sync. This is the prostaglandin in the beginning of the double off-sync. Here's the gene-RH, and then they do a full off-sync here. So those are the different types of pre-syncs that have been done. The controls, I didn't show you what the controls were. The controls were cows that didn't receive these manipulations up front. In general, all the studies I've looked at, there's an increase in fertility by about 7 to 9 points if they use these pre-sync options up front. But as you can see, as you expect, you're going to delay insemination considerably with these types of options, and at least these bottom two options, by 7 to 13 days or more, and that means you're delaying when you put semen back in those cows. So the caution here is that if you're going to use these pre-sync options to improve fertility, you really got to get a good bump in fertility to outweigh the lost time that you have by not getting semen in these cows as quickly as you can. Because if we were using option 1 back up here, we could have or option 2 rather, we could have those cows rebred 3 days after they were found open, or option 1, they would be rebred 7 days after the cow was found open. So you're going to increase the inter-insemination interval, and that's the thing you have to keep in mind. You're increasing days open, essentially, if you want to think of it that way. So you've got to really compensate by getting a lot more fertility by using these pre-sync options. These studies, basically, I've described for you here, were studies done where they had relatively no heat detection. Even in this third option here, where they gave prostaglandin to the open cows, there was relatively no estrus detection going on. And so a study that was done where they addressed that, you can see here what they did is the cows were inseminated here. They came to a pregnancy diagnosis right here, and they used estrus detection in these programs. So these cows were given prostaglandin when they were found open. 11 days later, the cows that hadn't shown estrus were put on a 10-day off-sync program. This treatment was a 7-day interval here with off-sync for the cows that didn't show estrus here. And then they compared it to a pre-sync gene-RH 7 days before the cows were diagnosed open here, and then went on a full off-sync. What you're looking at here in this graphic is the percent of cows that actually were inseminated. So with the 2 PG programs, the lines drop quicker. That means that the cows were being inseminated here quicker. With gene-RH, not very many cows were being inseminated with this program right here. The important point you'll see here is when they use the prostaglandin programs, only 23% of the cows were not inseminated before they went on off-sync. And so most of the cows were bred at heats in these options, whereas if you use gene-RH up front like you see here, most of the cows were inseminated by time. They went through the full off-sync program. So coupling heat detection in these type of programs really adds value to your program and gets cows inseminated quicker. All right, so let's go to and talk a little bit about pregnancy diagnosis as we conclude here today. Using transrectal ultrasonography at 28 to 30 days after AI has really become a new way of detecting pregnancies for a lot of practices now. It's becoming more and more popular. You can see in that middle diagram below, you can see the 35-day-old embryo there and the amniotic sac that surrounds it, and then that big black area is the fluid within the uterine horn that you can see there. Here he's doing the transrectal ultrasonography, and this is what it would look like if you were inside the cow looking back towards the uterus. You can see that palpation then at 35 to 40 days is the old standard pregnancy diagnosis that we'd call transrectal palpation versus transrectal ultrasound. So one of the new things that's out there are the PAGs, these pregnancy-specific, pregnancy-associated glycoproteins. The first one came to the market in 1982. It was known as pregnancy-specific protein B. Test kits became available in 93, and now there's 3 test kits out there available. You can see right here, you can use them in blood and one of them in milk, and this is the days since AI in which those blood or milk samples can be taken or collected. The best time to collect them is about day 32. That's when the peak in the PAGs is highest in milk and in blood. Notice that they go down a little bit. This is exaggerated from this upper figure up here where this shows this small decrease right here. And this is what the PAG would look like through an entire pregnancy for a cow that carries her calf to term. So the best time to take those samples is around 32 to 35 days. And the recommendation, or the earliest time you can do it, is shown in the slide here. And they can be then submitted to the laboratory. So let's talk about how we can use PAGs. We know when cows are identified pregnant early at about 30 days, we are going to lose some pregnancies. And most of those pregnancies are going to be lost in the next 15 to 20 days. And that's what I call placentation losses. That's the failure of that embryo, the new developing placenta to attach to the uterine wall. And that's where most of the failures occur in that 15 to 20 day period after a diagnosis that's been made at 30 days. And those often are unexplained. We really don't know what causes them. Some of them are probably caused by genetic anomalies, but they can be caused by cows that have mastitis. And because of the mastitis, they're giving off organisms that actually can be luteolytic and cause the corpus luteum to die, but we really don't have a good handle on early pregnancy loss. This is how we can actually use the PAG test. When cows are inseminated, you can actually take the blood sample or the milk sample, send it to the lab. You'll have your results back. If you want to start the pregnancy, start the off-sync in cows, you don't know if they're pregnant at this point at day 33. But then once you get the report back, you know that they're pregnant or not. Then you can complete the off-sync by giving prostaglandin to the open cows and have them re-inseminated within 3 days after you give prostaglandin. So this is how you can tie the PAG test that's done here at about 32 to 33 days with the resync off-sync program that allows you to get them re-inseminated as quickly as possible. So let's go to our last 2 polls and have you indicate your method of pregnancy diagnosis in this first poll. And the second poll will talk about frequency of pregnancy diagnosis.
Okay. Jim and Jeff, speaking for the Horge Dairyman farm here, we're using ultrasound, and that is our major pregnancy detection method at the present time. And this is one that people should be voting on pretty quickly. Not a lot of things to weigh here. So, all
right,
Jim,
Jeff,
how are we doing on the voting?
We're doing pretty good. Do you guys want to go back to back on these and then discuss them?
Yeah, why don't we just discuss this one real quickly here.
Okay.
So 19% of the respondents are putting palpation, 65% ultrasound, 7% are using the PAGs or a chemical test, and 9% a combination. And I expect those that are using combination are probably those that are thinking ahead of me here, and the importance of doing a second verification of pregnancy. So we do our first pregnancy test at about 30 to 36 days. We come back 4 weeks later and do a second pregnancy test to make sure those cows haven't lost their pregnancy. So that looks good. That's typically kind of what I expect, that people are starting to move more towards ultrasound depending on what their veterinary practitioner offers, and we have a small proportion of people using the PAG test. Okay, let's go to that next poll then. The last poll question, and indicate your frequency.
Okay, again here for the Horge Dairyman farm, it's a weekly occurrence. In fact, Monday afternoons are herd check at the Horge Dairyman farm, so that would be where we're coming from on that, with our herd of generally about 500 or so in milk and a total of 700 cows or so. So that's what our practice would be.
All right.
And Jim, how's the voting coming?
Pretty fast. We're going to close it up and
great.
share them.
Well, super, because we're kind of
Okay, so
go ahead.
we got 39% doing it weekly, 28% every other week, and 33% monthly. So what I would encourage those of you that are doing every other month or monthly to see if you can. You may be smaller herd owners. I don't know. It's usually the case. If you can visit with your veterinary practitioners so you can have more frequent pregnancy diagnosis, that would really help, because that means those open cows are staying open a lot longer when you're not finding those open cows as quick as you can. Remember that we pregnancy diagnose cows in dairies where we have 365-day breeding season to find open cows, because that way we reduce days open, and that's really important. So that's all. The only comment I'd make about that poll. So that's it for my presentation. I'd be happy to entertain the questions that have been submitted here.
Okay, Steve.
Do we have any questions? Did we lose Steve?
Here. Again, Jeff Stevenson, thank you very much for a great presentation. Covered a lot of ground, and we appreciate it, and we appreciate, of course, the sponsorship of Parnell for today's webinar as well. Let me make a few announcements here while folks might be considering some questions to submit. Of course, those of you that were with us today will be receiving a very brief survey, and we'd like to have your response on that survey to help us stay on target with our webinar series. And I also, of course, this webinar and all of our previous webinars are available in the webinar archives by going to hordes.com and following the prompts through the webinar section of our homepage. Looking ahead now, the farm program, responsible farming, from the actually three people from the National Milk Producers Federation staff will be giving us an update on the farm program for our next webinar on February 13th. And looking a bit further ahead, Dr. David Reed, an entertaining presenter, as many of you know, helping us sort through all of that parlor data that these electronic systems, some of which Jeff has referred to, all that information that we're provided, and what should we really be paying attention to, and to help us manage our herds. So with that, again, our appreciation to Jeff Stevenson and all Parnell. I don't know if we have questions, Jim, that I can see, but I have some that I would pose to Jeff. Jeff, what kind of looking at the economics of some of these different options that you have talked about, we know that there's a lot of value to having a cow pregnant, and of course, I'm sure there's all kinds of estimates about that value, but when we look at the cost of some of our obscene programs versus electronic monitoring and so forth, is economics much of a factor there, or just we want to compare their efficiency and we know that it's just important enough to get cows pregnant by a certain time that that's our key focus?
Yeah, that's a good question. Victor Cabrera is one that's addressed that on his website. He's got a number of different spreadsheets that one can do that at the University of Wisconsin. And basically what these things are showing is if you getting cows pregnant early is important, obviously. The value of the pregnancy, the cow that gets pregnant early is not as valuable as a cow that gets pregnant at 150 days, because you think about that cow that gets pregnant at 150, 175 days, she's going to have an extended lactation. But if you compare the programs where they've looked at the economics of using timed AI programs, especially those that resync and open cows, and coupling them with heat detection, you're always ahead economically if you can tie in good heat detection with a timed AI program. So that means if you start cows on a timed AI program, once they're found open, if they show estrus, you breed them and you discontinue the other injections, and that seems to always be the most economical, because the heat detection part is going to take away some of the costs that's associated with these programs and provide a better return on the dollar.
Pardon? Okay. Okay. Another question that I had here, Jeff, was when we first started hearing quite a bit about these monitoring systems and so forth, I think there was some concern that, you know, at some time we might have more limited use of the drugs available to us for reproductive management. And can you comment on that? Is that a concern, or we were going to be seeing maybe different types of drugs or some more controlled circumstances looking ahead?
Probably not the best one to address that, but we do know that the two hormones that we use consistently in the marketplace are being used very safely and according to Food and Drug Administration indications, and they are invaluable in most herds in terms of allowing us to get cows pregnant. Heat detection and activity monitors obviously are very, very important. In some herds, they'll always pay to have those because they may be beneficial to them, because heat detection is a difficult thing where cows are on concrete all the time. But I think the most important thing to remember is if you consider how much milk is produced by herds that are 500 cows or more in the United States, about 60% of the milk is produced on those dairies that have 500 or more cows. And most of those dairies are either large dry lot dairies or confined dairies, and they're going to require some type of reproductive management hormone program to allow us to get cows pregnant and produce the milk that we need to provide fluid and dairy products for a hungry world. Okay. So I think they both have their part.
Very good, Jeff. So let me ask this question that has been submitted by a listener. Our vet has had us change our fertility program in recent months to use a cedar sync program with GnRH and a cedar on day 1, prostaglandin on day 7, cedar removed at day 8, and GnRH shot 2 to 4 hours prior to AI on day 10. This is a program that is used for cows that are not cycling or are not at the stage in their cycle where they wouldn't respond to a single shot of prostaglandin to initiate heat. Is this a good strategy? That's a complicated question.
Yeah, it's a good question. What the research shows that the benefit of using a cedar or providing progesterone in the cow is only beneficial when the cow does not have a corpus luteum when you start the program. And so the data results show that when the cow is found open, if you put a cedar in that cow when she doesn't have a corpus luteum, that's a good use of a cedar. But that's only going to be about anywhere from 10 to 25% of cows that do not have a CL when you find them open at pregnancy check. And so the cedar is a very costly item. And so we've found in studies, others have found the same, that it's only beneficial to use in cows that do not have a corpus luteum. If she has a corpus luteum, don't use the cedar. It's just not economically valuable to.
Now here's sort of a question out of left field that you probably get sometimes at meetings. What about bull breeding? This is from someone whose religious preferences involve bull breeding, natural breeding.
Sure.
Advice to folks on how to do that well?
Well, the difficulty in managing bulls is there's so many factors involved. One is safety, and that's my biggest concern with bulls, is the safety of the people and the milkers and children and anyone that's bringing cows to milking parlors. Studies where they've compared bull-bred herds or natural service herds to AI herds show that the AI herds produce milk more economically. As you think about the number of bulls and the bull battery you have to get cows pregnant, when you only have bulls, there's a tremendous cost of that bull. Not only the purchase of the bull, but he's taking up one feeding space, he's taking up one free stall, and there's some issues associated with bull breeding besides the disease transfer that can occur by bulls transferring disease from cow to cow. So I personally don't see an advantage for it, but I know people have that, they have that preference because they have no other choice.
We also have two questions that follow this slide. Just
Go,
so you know.
go ahead then to those final two questions, because we're running out of time, but we still have a lot of people with us. So let's take a look at those questions that have been submitted before the webinar. And this is a reminder to those of you that when you receive an invitation or an announcement of the forthcoming webinars, you do have an opportunity to submit questions ahead of time. So go ahead, let's take a look at these.
Okay, the first question I addressed just briefly, that it's not uncommon that there's about 15 to 20% loss in pregnancy when cows have been diagnosed early with ultrasound. It says at day 28. The issue I have with day 28 is that sometimes that the technician has to be really, really careful before day 28. Day 28, 29, 20, 30, they can usually be very safe that they're seeing fluid, they're seeing an embryo, and they know that cow's pregnant. But the issue of losing 15 to 20% of the cows in the next 15 or 20 days, it happens. We just don't know what the causes of it. It can be related to mastitis. I mentioned that earlier. If cows that have mastitis tend to have more early pregnancy losses than what we see in cows that don't have mastitis. In terms of optimal voluntary waiting period, we use in our herd here that I'm responsible for and have an excellent manager, Mike Scheffel. We breed at about 65 to 75 days our first service cows, and we found that to work good. Our production, we just tested the other day, we're 105 pounds of milk per cow, and so we found that voluntary waiting period is ideal for us. Most of what I see in the literature from all the data from DHI and so forth, most people are using about a 50 to 55 minimum voluntary waiting period, close to 60. We're in that 65 to 75 day range, and I think that's optimal for the production that we're getting out of our cows. I think the next question is about the IDEX, and I think I addressed this question when we were talking about the the PAG test. The advantage is being able to get, it's just like with your veterinarian, you're able to get that cow re-inseminated as quickly as you can. So the best thing to do is to start, when you take your blood sample or milk sample, you start that cow on off-sync that day and with the G1 injection, and then when you have your report back in a couple of days, then you can know which cows need to complete the off-sync program because they were found open. And that's the advantage of using the IDEX test or any rapid test, is that some people don't have veterinarians close anymore. They can't get a good dairy vet close, and so that's an option that they have. Using the double off-sync with the second prostaglandin injection given before AI and resync strategy. I think I've addressed that question as well. The double off-sync, as I showed earlier, is going to, if you use a double off-sync that started before the pregnancy diagnosis, it's going to lengthen out the time that you can get that cow re-inseminated. That's the disadvantage I see there. So as early as you can get a pregnancy diagnosis, the better. That's always the issue, because we're really testing for open cows. That's the thing we have to remember. We're trying to find those open cows and get semen back in them as quick as we can.
Okay, Jeff, we still have about 90% of our audience with us, and we know you've done your hour already, but we'll have one more question here before we wrap this up.
Okay.
And that question is there evidence of value to a, quote, select sync, end quote, rebreeding program? That is, if found open with a CL, begin off-sync that day. If no CL, delay a week to begin.
Yes, that's a really good question, because if you have really good heat detection on a farm, one thing you can do is you can start with GnRH, as they suggested, which is the select sync, and then 7 days later give prostaglandin, and then breed those cows as they come into heat. Or they don't come into heat, then you can complete an off-sync. That's one advantage. I still think that the people that are finding cows open and the veterinarian says, hey, she's got a good corpus luteum, you give that cow prostaglandin, she's likely to show you a good heat and breed her back within a couple of days. And that's still an option out there that people forget about, particularly those herds where they have really good heat detection. But the select sync approach that's a good suggestion. to use that approach, and if she doesn't show heat by the time you give prostaglandin, you complete the OBSYNC. And so that is an option out there that's it's viable. Keep in mind, though, when you give GnRH, anytime you give GnRH, you're going to suppress estrus, suppress subsequent estrus expression, because if she does ovulate a new follicle and produces a new corpus luteum, she's going to have progesterone, and she may not show estrus in response to that GnRH injection. So that's the thing to keep in mind. That's why I suggest, if you got good heat detection, just give her prostaglandin if she's got a good CL, and pick her up in heat. If she doesn't come into heat, then you can put her on an OBSYNC the next week. You can start her on OBSYNC the next Monday, for example, if she didn't show heat in the 7 days in between the time she's found open and given prostaglandin.
Okay. Well, Jeff, thank you again very much. You've done a great job with presentation and a great job with the questions, and we appreciate it very much. It's good to have you as part of our series. We appreciate the support of Parnell. Just another reminder that the National Dairy Farmers Assuring Responsible Management, the FARM program, will be our topic next month, February 13th. 3 folks from National Milk Office will be the presenters that day, and we hope to have you with us. So thank you all very much for your attention today, and we look forward to having you back with us on future webinars. And that's all from Steve Larson up here at Ward's Dairyman today.